If you have only used traditional varnishes on your patients, you need to see how easy it is to apply FluoriMax non-colophony sodium fluoride varnish. Here's how you do it. Immediately prior to application, shake the bottle for 15 seconds. Flip open the dropper cap and then quickly invert the bottle and dispense the desired amount into the mixing well. Quickly turn the bottle right side up to minimize dripping along the dispensing tip. Recommended drops are, for the primary dentition, 1 drop, for mixed dentition, 1 to 2 drops, and for the permanent dentition, 2 to 3 drops. You want to leave the teeth moist, but immediately before application, have the patient swallow or use a suction to remove any pooled saliva. Dip the applicator brush into the mixing well. Now this part is important. Do not hold it in the well and supersaturate the brush. This will lead to white streaks and an over-application. Do a quick dip, or if you do oversaturate the brush, just remove the excess from the brush. Retract the cheek on one side of the mouth and start with the bottom arch. Make 1 swipe only from the posterior to the midline on the buccal labial surface of 1 quadrant. This will provide complete tooth coverage as the varnish flows and adheres beyond the brush width. If you see white streaks, or if your patient tastes a strong flavor after application, you have over-applied. Once you've done 1 quadrant, repeat in all quads. You do not have to apply to the lingual, as the varnish on the buccal side acts as a fluoride reservoir for the next 4 to 6 hours that benefits all surfaces of the teeth. Hold the cheek away from the teeth for 3 to 5 seconds after application to allow FluoriMax to completely dry and harden. For optimal results, advise patients to avoid alcohol, brushing, and flossing for 4 hours. However, they can eat and drink right away since FluoriMax varnish forms a tenacious tooth bond. Try FluoriMax at your office and enjoy a fast and pleasant fluoride application.